Is Parkinson's treatable? Yes. I'll tell you how in this short video. I'm Dr. Navdeep Kumar, working as a senior consultant neurologist in Noida. Today I'll tell you briefly about Parkinsonism. So, Parkinsonism is a broader diagnosis, and there are different types of Parkinsonism. The most common is Parkinson's disease, and other group of Parkinsonism is Parkinson disease plus. PD plus, it includes a lot of different types of Parkinsonism like MSA, PSP, DLBD. So I'll be more specific about Parkinson's disease. Out of 100% of Parkinsonian patients, 80% are Parkinson's disease. The good thing is Parkinson's disease is slowly progressive. It usually starts with tremors or slowness with one side of the body, mostly right side, right hand or left hand. It may start from the legs also in some cases. So it is asymmetric, starts from one side, slowly progresses and involves the axial system and then the other side of the body, and usually in few years span. So Parkinson's patients, they become slow, they have difficulty in doing their routine activities. Later stages, 10-15 years down the lane, then memory starts getting affected. But the earliest stages, when the patients they come to us, we do have some medications which can slow down the progress. All the Parkinsonian syndromes, they are actually degenerative. Degenerative means that it is bound to worsen. It starts from a group of neurons in the brain which starts getting disintegrated, and it starts getting destroyed at a faster rate. So eventually it involves the brain. So once we see a patient of Parkinson's disease, we start some medicines which slow down the rate of Parkinsonism, and you know that most of the symptoms, they are treatable. One of my patients, he came to me with the history of almost 3 to 4 years of Parkinsonism, very negative, on antidepressants, and doctor, nothing is possible, I know I'm going to die, I'm not going to respond, I'm not going to do my normal work. So as a doctor, rather than writing medicines, I feel it's important for us to motivate the patient and to tell them the truth. No false hopes, but to tell them the truth. So every time I would spend a lot of time just on motivating that person. He used to play badminton many years back. So I fortunately was, I could convince him to restart badminton. And he's coming to me for the last 3-4 years now. And actually I have reduced his dosage of medicines. And he's so active, so energetic, so positive towards his life. His whole approach towards life has changed. And a person of Parkinson's who had difficulty in walking, at times he needed some support to walk, is now playing badminton and is independent in his life. So this is how a lifestyle modification works in a patient of Parkinson's. Tremors respond to medicines, slowness responds to medicines. Even we have medicines which control the memory also, which can improve the memory also. They develop difficulty with urine and stools, difficulty in holding urine, constipation. So we do have medicines which can control that also. So it's not like Parkinson's is not treatable. In today's world, we have a lot of medicines and lifestyle modification that actually works. In later stages of Parkinson's, when a lot of disease-related complications or medicine-related complications are there, this usually happens around 8, 10, 12, 15 years into the illness. So there is a procedure known as deep brain stimulation. So it is like a pacemaker of the brain, like we have pacemaker for the heart, it's like a pacemaker for the brain. And this is a very old technique now, being practiced in India since 80s. And it's very refined now. So we put 2 electrodes in the brain and we stimulate substantia nigra. So that's a part of the brain which is involved in Parkinson's disease. And after DBS, patients, they have a good quality of life for next 10, 15, 20, maybe 30 years. So if you or any of your known has Parkinson's disease, so you can just tell them that they should feel positive. There is no need to lose hope. We have a lot of treatment strategies for Parkinson's. Have a great day. Thank you.